the hospital administrator, Lillian Posadas, onto the show. Good morning, Lillian.
Good
Good
morning.
morning, Chris. Good morning, Sabrina. Good morning, Guam.
I guess we'll just first start with Dr. Wen telling us that there's a COVID hospitalization. What can you tell us about that?
We do have one individual came in yesterday, sometime late morning, and from one of the clinics in the community, and so he is COVID positive, and so therefore is in our facility in the Care 3 COVID unit.
Can you tell us the condition of the patient?
He's stable. He came in manifesting some respiratory symptoms, and so, he needed to be hospitalized. He needed the medical treatment, so he is stable in the COVID care unit.
Mm-hmm. How old?
He's in his 60s.
And is that kind of why he checked in? Are you guys just taking extra precaution because he's elderly?
No, well, he was manifesting respiratory symptoms
Okay.
from the clinic. So he was transferred over from the clinic because of the respiratory symptoms that he was manifesting.
Can you tell us anything about how he contracted COVID?
No, we don't know. I don't have that information.
Right,
How? I haven't been able to get a briefing, more detailed briefing, other than he was transferred over from the private clinic yesterday, and so we've admitted him. That's all I have for now, Chris.
Right.
If I get more information, I can update you without disclosing too much of
Right, yeah.
protected health information.
Of course. Well,
Okay.
appreciate that, Lillian. Another thing I can appreciate is the last couple of times we've had you on, you kind of ended our conversation with this reiteration about how serious we should all be taking this COVID-19
Absolutely.
pandemic. And I remember we had brought you on, and I think it was when we were first starting to reopen things, and you had really made a plea to people that you were, worried that
Yes.
we're gonna do things recklessly when we
Yep.
reopen, and now we're looking at this surge and this spike. So, what do you have to
Yeah.
say about that?
Well, again, I plead to the community, please take heed and be very conscientious about it, and protect yourself, protect the community. We need to make sure that we don't see all the spikes as it is, predicted or anticipated. Let's not let it happen. But it takes the collective committed work of everybody in the community.
Did you want to ask? Oh, I wanted to ask about the Department of the Interior. They just awarded the grant, the $367,000 to GMH to
Yeah.
train nursing and revenue cycle management staff. Can you explain what is what is that? Revenue cycle
Is
You're
it
right.
psycho management?
cycle management.
What does that mean?
Are they
right?
psycho or what? How psycho are
Yeah.
they?
Well, what that revenue cycle management is, it's a process, a program, procedure for our medical billing section of the hospital, looking at the medical records and making sure that what services we provide are well documented in the patient's health record, so that it all gets translated, codified, and translated to then reimbursement for the hospital from the payers, such as the insurance. With making sure they're accurate, they're complete, and minimizing any disputes from the insurance, because we don't have the documentation, we don't have the notation from the doctors or from the services departments, such as radiology, respiratory, lab, pharmacy. They're not accurately and completely documented that we administered or we provided those services while the individual is in the hospital. And so we're just making sure that all of that is in there completely and accurately, so that when we submit the claims, the bills to the insurance, they will pay us. And we complete that in a timely manner, so that the payers will not dispute, well, you've gone over the 90-day, cap. You did not submit your bills in the 90-day period and accurately, so therefore we're not going to pay for this claim. So that's what that revenue cycle management is, the grant. We're going to do more training. We've recruited more coders but we want to make sure that they're trained properly and following the regulations for making these bills and these claims as accurate and as complete as possible.
Right.
In a nutshell, that's what it is. Does it make sense?
No, not really. No, I'm joking. It does. It does.
I was going to say, does it make sense? Okay, how else can I make it?
No. It does. I wanted to follow up on what we talked about last time. Gosh, it's been a while. About the Army Corps of Engineers report and how GMH was weighing whether or not it would be more economically and financially feasible to build a new hospital versus making all these renovations that were indicated was needed in that Army Corps of Engineer report. And I know that the plan was, what you guys are seriously looking at, and what the governor has already indicated was building a new hospital. Right. So has there been any further discussion on that?
Okay. Well, first of all, the Army Corps of Engineers, in their assessment, they recommended two options, and that's the repair and replacement and everything, all the deficiencies that we have. And in comparison to building a new hospital, the cost of building a new hospital is a little bit less than really going through the full gamut of repairing this hospital to meet all the code and the regulations. It was something like 700 some million, and the building of a new hospital was a little bit less, but it was still 700 some million dollars. So if we're going to invest 700 some million to do all these repairs and the fixes, why not just build a new hospital? Mm-hmm. And so that's the decision that we're going. That's the direction that we're going. And so we have a task force team put together to make sure that that goes forward. The board also, that was the recommendation of our board of trustees, is to have a task force to look at that. And also from the governor's office. So we're kind of on the same page in terms of we need to build a new hospital. Mm-hmm. There's just no question about it. Mm-hmm. In the meantime, we still need to make these repairs and the fixes, like the HVAC, the leaking roof, the envelope of the hospital, the walls and the windows. We need to get those fixed, because if building a new hospital is going to take probably 5 to 7 years, is what the experts, the engineers tell me. We need to continue the operations, and so we need to make sure that we don't have any more leakages, that the air conditioning, the heating, ventilation in all the patient care units are, up to standard, because some of these units are old and they need to be replaced. And so we still need to continue those repairs and those fixes while we're waiting for the new hospital to get constructed and get completed so we can move into it. The discussions have been ongoing in between all this COVID situation. We continue to have the dialogue and the discussions that we want to move forward with building the new hospital. Mm-hmm. The bill that the Senate and the Congress in the U.S. how much $1 trillion and that Guam may possibly get. 30 billion? Is it 30 billion? I can't remember anymore the number, the figure. I mean, if we get that, boy, that will be a tremendous source of, funding for the new hospital. So, but we're just now waiting for the U.S. Senate to take action on that one. But yes, the dialogue, the discussions are ongoing.
Okay. Is it too early to say what property is being eyed? Or location?
Well, again, from my perspective, the Manila property, or somewhere in Manila where it's close to the University of Guam, so that it's affiliated with an academic institution, and research is another issue there that I also strongly advocate for and support research for the island, and plus that it is closer proximity for the people of the South.
Amen.
That's just my own recommendation, but I think the governor has mentioned looking in the Barragata area. But there have been some other schools of thoughts from other, officials they're thinking, but I haven't gotten really anything other than what the governor has shared with us at one of the meetings.
Mm-hmm. Well, that's interesting. If it were to be located, I think, next to UOG.
Right, and then you would be able to just so easily fold in the nursing school there, and
Program,
Medical
yeah,
program.
absolutely. There's social work.
Right,
There's
yeah,
all kinds
yeah.
of academic programs that the students going through those programs can then can have the experience, the clinical experience if it's in a hospital, research opportunities, and I advocate for research because our population, the demographics of our population is different from the demographics of the people in the U.S. that studies are done. Many studies are done, even through Europe. But, let's have some research studies done on the demographics of our people. Once that, especially if it's a medical research, we can at least have some better idea how we can then tailor the medical treatment that fits the population of the island.
right.
You know what? One thing, I think it was pre-COVID. It was definitely pre-COVID. I was watching video of one of the board meetings, and I believe there was something that you had mentioned about. I don't know if it was a grant or something through the Department of Labor to help, I guess, not necessarily recruit, but to build.
Our resources.
Yeah. Do you remember that? Well, you probably do. Of course you do. Can you give us an update on that?
We haven't moved forward with that, but in our conversations with the representative at the Department of Labor, they received quite a bit, large amount of money, I think in the millions, for programs such as an apprenticeship program.
That's it.
And right. So what we were looking at, UOG and I think GRMC embarked on a program to then for a nurses' aides program. And so they started that over there, and we were looking to replicate that here at GMH, but COVID hit us, and so we had to put that aside. But it's still an opportunity. And I believe the funding is still there. It's still an opportunity for individuals who, if they're interested, if they have that desire to be in the track of a health career, the starting point can be a nursing assistant. And then hopefully that their desire continues to blossom and they want to become registered nurses or, in another discipline in the health profession. Because, health profession, we need them. We really need professionals in our healthcare industry. And so, we're going to try and revisit that once we can get off this COVID or put some time aside and energy. And also the Department of Labor, with this recent COVID, they've got some funding to then hire those who have been displaced from their jobs. And so, we're looking to see how we can take advantage of that resource, that funding resource, to hire or train people in the hospital.
Yeah, I only brought that up because we definitely, like you said, we need more people in the healthcare profession right now.
Yeah.
And we have our people on island that, are have the talent, and we just need to kind of help them get on that track.
We just all the graduates.
Right. Well, and help get people off this track that they feel helpless, they can't get a job. They can. We just need to kind of help nurture them and support them that don't feel helpless and hopeless. There are opportunities.
All right. Is there anything else going on over at GMH?
Well, we had the budget hearing yesterday,
Right.
so I think that went well. We're trying to live within our means, and so we're trying to also do our part to generate the revenues to sustain our operations.
You're not planning on retiring anytime soon?
Yeah, are you retiring?
Are you?
I am a retired government employee, so no. It's tempting. I'm 65 years old, and I'd like to enjoy life a little bit more with some time because my husband is retired. But no, we're here. We have issues to deal with, and so God willing, as long as God is allowing me to wake up and my brain functioning, I'm here for a while unless. The Board of Trustees says, Lillian, we're not happy with you. We're going to get somebody else.
Right.
Just make sure you're taking your me time.
Yeah.
Yeah, I have.
Don't
I
stress. You know, as much.
Well,
I know you're gonna stress, but you know.
I still have my license as a nurse. I can still work, so
All
go
right.
back down to the front line.
There's an opening at the airport.
I can still take blood pressure and I insert IVs and insert that NG tube. So
There's an opening at the library. Do you have a master's in library science?
no, sorry.
Oh, neither did the
Don't
last
that.
lady, so no worries.
Oh.
Ciao.
All right,
All right,
Lillian.
Lillian.
All right, thank you.
Thank you so
Take
much.
care.
Stay
God
safe.
bless you. Wash your hands.
Stay safe and wear your mask. Practice social distancing. Wash your hands.
Amen.
Thank you.
All right.
Have a good weekend.
You too. Bye bye.
Okay, bye. Good morning. It's 8:40. Let's keep it going on the phones here.